Well, hello everyone. Welcome to this webinar organized by Investigate Europe. My name is Max. I'm a journalist for Investigate Europe here in London. Investigate Europe is a team of investigative journalists. It's really in the name, isn't it? Working on cross-border issues that are relevant to people around Europe. So our latest investigation, which kept us busy for most of this year so far, was about drug prices and drug availability in Europe. So we started on this journey because some of us in the team were sort of puzzled by what seemed to us like a very European contradiction, which is that when new innovative drugs are centrally approved by the European Medicines Agency, their producers are essentially granted a monopoly across the continent. But that's the extent of our centralized model in Europe, because after that, it's up to each EU member state to negotiate secret prices with companies directly, which I'm sure a lot of you are familiar with if you work in the industry or the public sector. So we wanted to find out how this model might impact drug prices on one hand and accessibility to treatment on the other. So the result of that research was a project that we called Deadly Prices, which was an expose of inequality and opacity. So that investigation was published in 20 countries in collaboration with 25 media partners across Europe. And we were delighted to learn in the recent weeks that we were shortlisted for the EU's Daphne Caruana Galizia Prize and the German Reporter Prize as well. So if you haven't read it, please head to our website and you'll also be able to subscribe to our newsletter there and to support our journalism if you can. Now, to discuss these important issues, I'm joined by a fantastic panel. As you hear our guests introduce themselves, you will notice that we don't have anyone representing the industry, the pharmaceutical industry. We did try to invite someone from FPA, which is the main industry lobby in Europe, but they couldn't put anyone forward for today. So by all means, if you're working for the industry and you have questions or comments, you can put that in the chat as well. I'm now going to let our guests who could join us introduce themselves. And I'll do that by screen order. So I've got Eliana first. If you could just briefly introduce yourself.
Thank you, Max, and thanks a lot for this invitation that was directed to the OECD. My name is Eliana Barrenho. I'm a health economist working on pharmaceutical issues and policies at the OECD. And I have actually led the work on price transparency that the OECD undertook in the last 2 years. So it's a pleasure to be here.
I have Wilbert next on my screen.
Hi there, my name is Wilbert Bannenberg. I'm from Netherlands. For 35 years, I worked on low middle income countries on access to medicines, mainly essential medicines. The last 5 years, I've actually gone back to the Netherlands. And in my retirement, I'm now actually fighting excessively priced medicines. And we do that through the Pharmaceutical Accountability Foundation, a non-profit institution. And we at the moment having a court case on excessive profits, which we'll discuss later.
Thank you. Gayle, please.
Hi, thanks, Max. It's really good to join you all here today for this really interesting discussion. I'm a CF mum. I've got a 20-year-old daughter with cystic fibrosis. I live in the UK. Just a very quick description of cystic fibrosis. It's a genetic progressive disease with no cure. If it's not treated at all, children die in childhood, early infancy. And it causes a buildup of thick, sticky mucus in the lungs where it causes the most damage. Without treatment, it's fatal very early. The drugs that we've been fighting for are the first of a sort of medicine that actually treats the underlying cause and is transformational. And so that's why we're fighting so hard for it. After several years for campaigning for access to these drugs in the UK, I realised that, for a rich country to take that long, the difficulties it would cause in lower income countries. So I started grassroots campaign group Vertex Save Us and the Right to Breathe campaign with Just Treatment. And our aim is to empower families and governments to use international laws to challenge Vertex's patients and get access to these drugs.
And Efretiki.
Yes, hello. I'm Eurydice Bersi. I'm a journalist with Reporters United in Greece and Investigate.
Yes, thank you very much. Eurydice, actually, I want to come back to you immediately because you were one of our lead researchers on this investigation, Deadly Prices. Maybe if you were to summarize it in a few takeaways, what were our main findings, please?
Yes, thanks, Max. And you also did quite a bit of heavy lifting for this investigation. Let's not forget this. So what we did is we looked at the pharmaceutical industry. It's should be very clear. We don't see the industry as a single uniform entity. In fact, we're certain that most people inside the industry know nothing about the main finding of this investigation, which is that pharmaceutical companies tend to charge the strong less than they charge the weak. The real price France pays for one category of very expensive drugs, the ones Gayle just referred to, is, well, very expensive, but Lithuania pays double that. And Lithuania is accessing those drugs 4 years later than French patients. Actually, after our investigation was published, there was a renegotiation in Lithuania with lower prices, wider access, but we don't know the details. And why we don't know the details? Because real prices are very, very tightly kept secrets. And so here's why our findings could be interesting. Because if indeed the main driver of real prices is volume, so the higher the volume, the lower the price, then it would make total sense for all European countries to band together and demand a common price, at least for high-cost innovative drugs that are centrally approved by the European Medicines Agency. And this common price will be lower than the price paid now by even the strongest country on its own, because of course the sales volume in the whole of Europe would be much bigger than the volume of sales in any single country. Stronger countries are the biggest proponents of secrecy because they think they're winning, but the only winners from the current divide and rule system are the companies imposing secrecy and separate negotiations. So now, if you've come back from the pharmacy with a pack of medicines, you might look at it and say, what secrecy? I can see the price right there. But what you see is the list price. It's not the official price. It is the official price and not the real price. Because the real price is what the health insurers buy in bulk, when they buy the drugs in bulk, and this is the secret. So just by looking at this pack, you would never guess the amount of fear, the sheer fear among state negotiators all over Europe caused by these secret agreements with industry. We know because we spoke to several, and they're terrified that if the real price leaks, they'll face the wrath of industry in the form of legal consequences. And they also fear industry will simply withdraw medicines from their country. We found that those types of threats of withholding the drugs are very common. And in this instance, too, banding together would help. It's much more difficult to threaten the whole of the EU than to threaten one single country. So how far are we from forging, are the European countries from forging a common approach? If we only look at the surface of things, we're very, very far. Few people dare to even articulate such a policy for fear that it would be a career killer. But under the surface, the plates are shifting. So in a while, we'll listen to Eliana Barrenho from the OECD outlining what health authorities think about transparency. She and her team, they did a long survey among 34 countries. And if you allow me to sum up the conclusion, most countries would like to share information on real prices so as not to negotiate blindfolded. 18 countries are even interested in participating in a pilot project of net price transparency. This is news. So I'm very curious to find out about this. Eliana, the floor is yours to please tell us more about your survey.
Thank you so much, Eurydice, and I hope I pronounced correctly your name, which actually is a very nice one. First time I come across this name. I hope you hear me well. And thanks for the introduction. This is really a very I would call it passionate topic and also very difficult one. Let me make some initial remarks about price transparency, and then I can highlight the main findings of our survey. Let me say that, in fact, the OECD has been for a long time writing about this fact, which is actually a broader issue above prices, which is the fact that the pharma market is broken. It doesn't really deliver the innovations that we need at the prices that we want and that actually countries eventually can afford. And that is because not only there has been a lot of focus on a few areas, such as cancer and other disease areas, where there has been a lot of investment, but with very marginal improvements for the populations, with very high prices attached to it, and too little focus in other areas where there would be and there is need for actually treatments and cures. Oh, I think this is probably someone that is not on mute. So the problem of the proliferation of confidential agreements
And I think Eliana froze, didn't she? Yes, she did. Okay. Well, I mean, let's move on while she comes back to us. Perhaps we can talk to Gayle, because this issue of opacity and secret prices, as it was very much the part, like the core of our investigation, and that's how we discovered that some people in Europe pay more for cystic fibrosis drugs than others. You know, that was a big win in terms of findings for us, because we were able to get average estimates. You know, it's not the real net price of one drug, but it's an estimate of the cost for the whole year for a patient. We realized that it seemed that it was a lot more in Eastern and Central European countries than in the West, and I suppose that was quite an interesting finding for you, Gayle, to mull over after many years of campaigning.
Yes, I think it was. I mean, there were elements of your story that sort of surprised me and elements that didn't. Like, you know, I know that obviously Vertex tried to capture the richest countries first, and obviously they had the most bargaining power. So we can see how prices were forced down in those countries. But to see like the extent of the differences in prices between the lower income countries I found quite shocking. And I think that society as a whole has this expectation of pharmaceutical companies so that they will, you know, show restraint in lower income countries and they'll show humanity. But actually, in my experience in the last, 7 years, I've seen that pharmaceutical companies do not have those characteristics. Like, their main aim is maximizing their profits. And if that means leaving countries with lower incomes and lower patient numbers to die, then, they will do it. And so that's something that we have to challenge going forward.
Can you tell us a bit about, Vertex Pharmaceuticals as a company, their strategies that you've observed in terms of negotiating with governments and in terms of pricing?
Yeah, well, I suppose going back to the UK campaign, we obviously fought for 4 years. I mean, we're one of the richest countries in Europe, and for it to take that long, and we tried lots of things like the traditional sort of protesting and putting a lot of pressure on the government. But it was actually when we put these international laws around compulsory licensing that I know we'll talk about later, when we started to get the government to threaten Vertex's monopoly, that is when we saw like a change in behaviour, and we believe that the prices were dropped. And so, from that, we learned how to use that strategy. But in countries around the world, we just see that there really is, they don't give any priority to the lower income countries. I mean, at the moment, Vertex's drugs are only available in 2 middle-income countries. No low-income countries around the world have access to these drugs, and there is very little, it looks like very little intention to supply those countries unless there is a force put on Vertex to change their behaviours.
Thank you. I think Eliana is back with us after a brief freezing episode. Maybe we can go back to where you stopped, but we were talking about your findings from the report, and I guess we're curious, especially after having just heard from Gayle about different pricing around the world. Is a pilot project where they will share prices likely based on what you found?
Yes, and I'm sorry. I hope now things will get smoother on my side. Yes, so let me go over the main findings of our survey that was actually conducted, was circulated actually to OECD member countries and EU member states on a total of 43 countries during the spring of 2022, of which we got actually 34 responses. So 34 countries actually responded to this survey. And the idea of the survey was actually to explore the willingness, expectations, and motives of governments and payers in sharing information on medicine prices, a wide range of prices, but of course with a particular focus on what we call the real net prices, those that consider also the rebates and the discounts eventually negotiated in closed doors. And I can highlight 4 of these main findings that in more detail you can find in our report that was just recently released. The first one is actually that there is a broad interest in medicine price sharing. All respondent countries did indeed say they want to gain access to prices and for prices for a range of products from their counterparts. Why? Because they actually want to boost price negotiations with this information, and they want to sharpen their counter arguments. In fact, it's important to state that most of these countries already engage in some sort of price sharing initiative. They typically don't involve not the real prices, but some sort of list prices, either from the wholesale or retail sector. Also interestingly to see that these countries, all of these countries, they majorly are interested in getting data from the EU member states. Let's not forget that the OECD is actually, as you know, geographically much more diverse. So we actually capture all the continents, and the interests on the EU, the prices paid by EU member states are actually, let's call it a consensual one. But this interest drops when it comes to emerging economies or the low and middle income countries. And what kind of prices they're after? Well, it's actually a full range. They are, of course, interested in net prices, but they have mentioned they would also like to know what are the maximum regulated prices and even the reimbursement amounts that the main health insurance programs are actually covering, and also list prices. The second main finding is the fact that everyone wants to access to this data, but not everyone is willing or able to share this data. And what is the result of that? Well, it's actually a patchwork of cooperation that falls short in terms of full transparency. You have less than 1/3 of the countries who want price info, but are not really able to share it straight away. And when it comes to the most sensitive data, the net prices, the gap actually widens. So let's take the net prices. Out of the 24 countries that are eager to see these numbers, only seven countries are actually prepared to share them. So actually what this shows is that there is a bit of a free riding issue happening, which has been actually already documented by us in the previous report in 2022. You have a free riding issue among payers. Everyone wants to get access to this data, but then when it comes to share, to others to benefit, then that's really not there. Also, interestingly, most of the countries want a sort of a give and take relationship. So they want to share data with those countries they would eventually will get access data from. The third main finding is the fact that most countries say they are not, and this has mentioned already before by you, they are not able and they are not prepared to readily share prices because of confidentiality clauses. So 32 of the 34 countries who responded to the survey mentioned that clauses prevent them and are the main reason for not being able to share this information. And why? And we have questioned this, but why all the secrecy with these clauses? Well, it's actually very much the law or the contract, the way it's written, kind of prevents payers from actually sharing that information in some way. This is particularly affecting high-cost patented and rare disease drugs. The final finding is the fact that when we question countries about their interest in participating in a pilot mechanism for sharing net prices, 18 of them actually are interested to do so. So nearly half of them. So there is some sort of contrasting signs of they want to participate, they are not ready to do so. We can only see that there needs to be some policy changes happening on the contractual basis for this to happen. This is the main conclusion of this study. Now, interestingly, these countries, the majority of these countries prefer to try this pilot on a closed, confidential network basis, and not so much in going into fully public disclosure. So we are now actually preparing the next steps for how this pilot could be undertaken. And we are awaiting the next meetings at the OECD to actually advance this discussion.
Very interesting. Thank you very much, Eliana, for this. Could we just could we just ask what is blocking? Is the fear that I was talking about before? What are the real obstacles that you see, and how do you think that the pilot project will overcome them? If you could just give a short answer to this.
Well, one of the next steps that has been mentioned when this report was released in our meetings was actually the full understanding of the legality that is, around these confidentiality clauses that is surrounding these, these negotiations is not fully understood, and the extent to which that is a barrier for sharing is something that needs to be, needs to be understood better. So there are fears, as you said, but there are also, and we consistently hear countries, payers mentioning, there are in fact clauses preventing them from doing so. And so if moving to a sharing situation will make them doing something illegal, that kind of, it basically is a barrier to do so. So I think this is one of the ideas that, this work could, the next steps for this work could be doing is to actually better understand, with legal experts actually on the side, to really understand what is workable, what is changeable, and what is not, if countries want to make, this sharing of information.
All right. Thank you very much. I mean, we've heard a bit from Gayle earlier about, the impact of that secrecy and high prices on availability. I want to ask Wilbert about what he's observed in his own country about high prices, especially because you have a very specific case, right, where you've estimated that high prices of one drug in particular had a particular impact on your government. If you could tell us a bit about that case, please.
Yes, with pleasure. In fact, we actually looked at a drug that was the most sold drug in the world before Corona, which is the drug is adalimumab, or brand name Humira, made by AbbVie. And we actually have from good sources, the US Congress hearings, that AbbVie actually states there that they made 78% gross profit on the product. And if you know that globally they actually sold $228 billion, that's actually quite a huge amount of profit. The case that we are doing in the Netherlands is to try and ask the courts what is permitted, how much profit can a company make, and when is it actually starting to get painful and for society, and is enough not enough? Now, there is no law actually. In the Netherlands, you are allowed to make profit. You're allowed to make a lot of profit. Technically speaking, you're not allowed to make excessive profit. That is in the competition law. But our competition authority is not very active. And so therefore, we had to bring a civil case to the Amsterdam courts, and in which we asked the court to actually determine if it is permitted that a company makes 78% gross profit. We allowed the company 25% as a kind of fair profit. That's already quite a lot, some people think. But so then the remaining is 53%. And on a 2.3 billion turnover in the Netherlands alone, this is 1.2 billion euros that were actually paid by the health system in the Netherlands to the shareholders of that company. And we're asking the court to declare that is not correct. And the case is running at the moment. So we will know from AbbVie how they respond to our demands by 22nd of January. And somewhere in 25, the court will give its first verdict. No doubt the company will appeal, and it will take 3 more years before we get to the highest court in the Netherlands. But then we'll know what the real case, what the statement is of the courts. Is it permitted to make 53 excessive profits?
And it's just not any drug, as you've mentioned. It's been the most lucrative, right? And it's got a very particular history, because if I'm not wrong, it was developed initially by public university researchers, and then when AbbVie took it over, they had quite a what was described, especially in the US Senate, as an aggressive patenting strategy to keep it expensive for a long time.
It's correct. Most useful medicines are actually not invented by pharmaceutical companies anymore, but by universities, and then they're actually bought up by a startup and then by a kind of company at one point. AbbVie bought this company, Germany, BASF. Anyway, it doesn't matter. They actually then realized they bought the chicken with the golden eggs, because this drug was miraculously effective and also very profitable, and they could actually use it for many different indications. So that's why the global turnover has skyrocketed to the best, most sold drug in the world, I think since 2009. This ended during Corona, when of course Pfizer got something else to sell to us, and at the moment it's a cancer drug that is the highest sold drug in the world.
All right. Yeah, thank you. I mean, it's really interesting to see that some NGOs or activists have to go to court to sort of get to the truth about pricing, or to reveal these issues. I want to quickly ask you, Gayle, about the sort, because I know there are some lawsuits against Vertex as well for access, aren't there? Is it one of the only ways for some countries with low access to access the drugs in the end?
Absolutely it is, and just the threat of doing that, the threat of taking legal action is often enough to force some sort of change in behaviour. As I think Max, we helped support a CF patient in South Africa who went to the courts to ask for a compulsory license, again we talk about, to allow a cheaper generic of the drug to be brought into South Africa. Very, very powerful case that she put. And actually, it didn't sort of go the full distance in court, but during the process, it has forced Vertex, who have taken action and now made an agreement through a non-profit organisation in South Africa, and now supplying patients there with high-end medical insurance at a greatly reduced price. And 40 to 50% of patients there are now getting access. Not ideal. We still have work to do for the rest of the patients, but shows the power of sort of legal action. And we've seen legal action in Turkey, where they threatened again to bring generics into the country, and Vertex basically sued them for trying to do that, and blocked access to generics, and have since then also failed to supply the drugs themselves. So 7 years after that action was taken, patients in Turkey only get access if they sue their government for full list price. I mean, it's the power that Vertex have over these countries it just should change. And we're seeing also in Latin America, they're threatening legal actions there. And in India, actually this week, patients again have written to the Ministry of Health demanding that they break the patents. And there's been action in the Delhi High Courts saying that Vertex are not working their patents there and blocking patients from getting access. So there's lots of things happening, and we do see results when this threat is executed in various countries.
Thanks. I should just perhaps give one comment to Vertex. They're not here, but we've engaged with them a lot, and what we often hear from pharmaceutical industries, and Vertex included, is that their prices are based on the value they bring to society, and that it's also a negotiation. So they're not the only ones responsible. That's done on their behalf. I want to look
to that as well quickly.
Yes.
I've heard this argument. They say they've worked 20 years to design, discover and develop these drugs, but they would not have started it without $150 million from the CF Foundation. That wouldn't have gone anywhere. They have now recouped their research and development costs 3 times over. This is academic research that's just been released. In 2023, they made $9 billion in CF product revenues. And at the end of last year, they had 13 billion in the bank. If they carry on at current levels without even making any more access agreements, they will make $192 billion in CF revenues by the time the patents expire. That is unacceptable. So whatever they say about research and development, it doesn't wash.
It's a very profitable company indeed. If you look at some of the numbers that we put in our article as well, there's some very profitable entity for sure. I want to go to some of the questions that we have, because we have a lot of questions now popping up in the chat. One of them is about the European Commission, and the fact that we in our article mentioned that the EU Commissioner was supportive of price transparency. But this person who asked the questions, who's a journalist, says that from what she hears, there seems to be that the Commission is ready to have less control over prices in exchange of innovation and production, and they're asking if we could elaborate a bit on the fact that the EU Commission has little leverage over this. I don't know who wants to pick that one up. It's very EU policy oriented. Nobody.
I can start.
Go for it.
Yes, so I think thanks a lot for the question. And I think you have mentioned this before. I think it's a fact that while we have a centralized procedure for marketing authorization of some medicines across Europe, ultimately the pricing and reimbursement decisions are actually of national jurisdiction. They are not supposed to be, and they are not currently, in the current state of affairs, they are not part of responsibilities of the Commission. Now, there has been some, exceptions. We've seen this during COVID, where there was actually a joint procurement for vaccines, that took place. And so the Commission actually in bulk bought for all the EU member states the different vaccines and negotiated their prices. There are some discussions about whether this should be these sort of arrangements should be extended to other types of medicines, but overall, the pricing and reimbursement decisions they ultimately are of national jurisdiction, and the discussion whether they should or not be, that actually needs to be a discussion, that needs to happen around the table. Countries not necessarily want to give up that decision.
Anyone else in the panel?
Very quickly, from what we understood in the investigation, the EU Commission pays lip service but does not want to act. This question was unfortunately spot on.
We have another short one that I'll just read out quickly because it's also about policymaking and regulators. Clearly, big countries typically have more bargaining power, but I think we should not confuse the pricing narrative of volumes, which is technical reason, with the power dynamics, where we need policymakers to step up and use their regulatory power. Anyone wants to comment? I think it's about whether payers and regulators can impose more things that are not based on just purchase volumes.
It would, of course, be better if countries group together to actually do joint procurement. We saw during Corona, then that was also done, although it was not always very transparent, what Ursula was texting to the boss of Pfizer. But on the excessively priced medicines, there are actually some examples. I mean, the Benelux group actually negotiated a lower price after countries first refused it for a gene therapy. So it is possible to actually collaborate together and to do a joint negotiation. But the problem is, of course, that the countries are all so different, and officially it's a kind of national prerogative to set prices and to negotiate. And it is very unfortunate that then the countries that have the biggest market power actually seem to be getting lower secret prices than the countries that have less power and are more have to agree to a lower to a higher price actually. You see also the other thing, that sometimes the drugs are so expensive that the drugs do not get on the market at all. So it's not then the price is not the problem, then it's that the government or the reimbursement organization is not willing to put that product on the market, and then patients have no access. That we see quite a lot with highly expensive orphan drugs that are being actually sold at ridiculous prices. And as I see in the chat also that there is no relation between price and cost actually. So the drug companies just ask what they can get, and we need definitely a different system. Just today, somebody published a systematic review on the different systems that do exist in technically on how to actually deal with high prices. I'll try and find that link and set it in the chat.
Yeah, you were saying that companies can ask high prices up front. I think that's something we realized during the investigation as well, talking to negotiators, and I'm sure there are some here, that the level of knowledge that they have about what the neighbors pay is very little, if existent at all, and the level of knowledge they have about the cost of the product itself, like what it costs to make, is very small as well, which puts them in a tight spot to bring prices down, I suppose. I want to talk about solutions now, or ways forward, or potential ways out of this system, because we're already more than halfway through. Perhaps, Eliana, briefly, from what you've heard talking to various countries, what could they agree on? I mean, Wilbert was mentioning joint negotiations. Is that something that could happen again, as it did during COVID? And maybe price transparency. What could they agree on for sure that you've seen?
Yes, well, that's a very good question for which I must say we are currently battling with understanding what is actually the next step in addressing this issue. We definitely see with our work on price transparency that it really will take a massive coordinating international action on sharing net pricing data for this to happen, and an extraordinary political commitment to do so, and particularly to overcome what is dominant right now, which is national self-interest. You do have in our previous report, when we examined the consequences, the likely consequences of greater price transparency, we understand that there is a varied, even amongst payers across OECD, and even if you look within the EU, you don't have an homogeneous interest in this sharing. So it really will take some other level of commitment for that to happen. That also means that it will also require significant legal, contractual, and policy changes for any further sharing of net price data to happen, because right now seems like these regulation and legal constraints really prevent payers from actually sharing information. And I would point to the fact that there will eventually have to be some sort of commitment across countries on what they would be willing to accept on tier pricing or price differences. What I mean by this is that we cannot expect that a full transparent world on prices would mean that everyone would be paying the lowest price. So that means that eventually some will pay more than others. Now the question is, how do we arrive to an equilibrium where everyone agrees that I don't mind paying a bit more than others for that to happen?
And that's a great segue into going back to Wilbert, who's looked into these issues of pricing and the sort of cost plus model. Can you tell us a bit more about that? Because that was very much at the heart of your lawsuits with AbbVie as well, to determine how much they may or may not have overcharged the government.
Yes, the company actually had to reveal to the US Congress, as Bernie Sanders there, how much they actually spent on R&D, and that was about 11%, and also the cost of production and sales was 11%. So they made 78% gross profit. There is need for a different model. At the moment, what you see that drug companies ask whatever the market can bear, which is normally listed as the value-based pricing system. But what is needed, that we also need to know how much does it really cost to actually develop these drugs, do the research and development. There is actually a definition of a fair medicine price of World Health Organization, which is basically that the fair price is a price that society and or the consumer can actually afford. If you look at it technically, it comes closest to what is called now the AIM model. That is the International Organization of Health Insurers. They have already a fair price calculator live for 5 years, which is at the moment being strengthened. And in the review that I just shared in the chat, that one came out also as the most attractive in my view. Now, obviously, companies are not really looking for something to have a fair price. They want to have maximum profit. So there is a need to actually have enough power in the National Health Technology Agency so that they know how low can they actually negotiate. And what we are proposing in the Netherlands is that the drug companies will be forced by law to actually disclose to the regulatory authority, to the Health Technology Agency, the actual cost of development, the production cost, a fair profit, but plus a second plus, which is a reward for doing innovative research that is useful for society. So there is a willingness from society to actually give more to the companies than just the cost plus method. This is called cost plus plus. It is closest to the AIM method, which is actually in the chat. And now, needless to say, states and health insurers are very eager to actually use that model, but the drug companies totally are not interested. They want to have the highest possible cost. And the problem is that even in the Netherlands, the last couple of years, the prices are rising so much, and there's so many new effective, innovative medicines coming that even the Netherlands cannot afford to actually keep paying the list price that they ask. And therefore, there is a new system needed to actually mitigate the ever increasing prices.
So we've talked about joint negotiations, about information sharing, about potential new price models. Gayle, I want to ask you, what else could be done to make CF drugs more accessible globally? We talked about compulsory licensing earlier. Is that a way? Are there other ways possible?
Yeah, thanks, Max. I think, like, from this conversation, I think most of us can see that it does need a lot of reform, the whole system, which could take time. But just talking about like compulsory licensing and the tactic that we're using, I mean, this compulsory licensing, it already exists. For people that don't know, like, it's a mechanism in intellectual property law that gives the government the power to override patents where there is monopoly abuse, where patients are dying. Like we're seeing in countries around the world, they just can't access these drugs. And so we basically are empowering patients by linking them with human rights lawyers who have knowledge in each specific country around these laws. And so then taking that to the government and saying, look, you can't just walk away and turn your backs on these patients. These are the laws. If you can't get the drugs for a reasonable price through the drug company, you have every right to override the patents to allow other manufacturers to make these drugs at an affordable level and to get the drugs to patients. At the end of the day, that is the most important thing, and governments should be using these laws. So in terms of Europe, I think, ensuring that compulsory licensing could be used in Europe if necessary, to give governments the ability to override the laws, and also to tackle issues around data exclusivity, marketing exclusivity, which also can be a barrier within Europe to countries getting access. So I think that is also a different way of tackling the access issues that could be used immediately, as we are doing in other countries in the world, to break the patents if necessary.
Thanks, Gayle. Eurydice, what do companies say about those solutions, and what do they offer themselves to keep prices affordable for everyone?
Well, the compulsory licensing is definitely no solution at all for the companies. They do not even want to hear any discussion about it. But this doesn't mean that they like the current system. They also have proposals to change it. What they particularly don't like is the international reference pricing, the fact that if a country lowers the price, others can see it and then lower their prices accordingly. It's interesting that they accept that there is inequality. They accept the fact they do not dispute the fact that poorer countries can pay more. It's this gray area, and they say, but we have solutions for this not to happen. The solution that they're keen on introducing is called equity-based tier pricing. It actually is a staggered pricing system according to what each country can pay. This is if we have any company representatives who would like to explain this better than I do, please go ahead. But yes, that's their proposal. It does not definitely do away with secrecy. Secrecy is still there, even with this system.
Thank you. And yes, indeed. I mean, something we've realized during this investigation, and that we've heard from many sources, and that we were able to prove as well, is that it's not necessarily the poor who pays less. In many cases, poor countries do pay more because they can't buy as much as big countries, and they don't have the same bargaining power. So it'd be very interesting to see how they would defend that, to the end. We have one question about the OECD, so very, very relevant in this context, which is, given the growing recognition of economics and social rights, do you think there is scope to use the OECD's complaint procedure, which examines potential corporate misconduct, to target excessive pricing by pharma companies? So could people use the OECD to go after companies? Is that something you're familiar with, Eliana, or not your scope at all?
The OECD cannot really go against companies, but the OECD does have a whole lot of work that relates to basically competition law, and all the infringements that relate to possible misconducts of companies on actually charging for these high excessive prices. This is work that is basically overseeing how national competition authorities can or not leverage their power in order to actually, more efficiently target these misconducts and do enact, proper best practices and policies to do so. So we do indeed have that, but ultimately, that's ultimately again a national jurisdiction that indeed the OECD advises and oversees.
Thanks. We're nearing the end. Oh, go on, Wilbert. Yes, you have a reaction.
I think there is also the OECD guidelines for multinational enterprises that deal with human rights. And in fact, we are in the case against AbbVie. We're using human rights as one of the things. Drug companies respect human rights, they say, but it is difficult to force them in a court. But with the human rights report of OECD, increasingly now the EU has even also said for the very big companies, we can actually go and apply these human rights more. Some countries in Europe also applying national law for that. So I think in the future it will be that the human right to actually access medicine, that's a defined human right, should actually be the worry of a drug company which asks the price so high that the patient or the country cannot afford. And therefore, I think that could be useful track to consider. I'll try to finish, put the website of the OECD report in the chat. Thank you.
Just on that human rights angle, we actually filed a formal complaint to the United Nations on Vertex for ignoring human rights guidelines for pharmaceutical companies. Obviously, they asked that there's a global access plan and all sorts of tiered pricing. Obviously, Vertex flaunting all that, but as you say, Wilbert, there isn't really any legal backing to that. It's just guidelines. But it would be great to see that those are strengthened so that they actually can, cause drug companies to act differently. That would be fantastic.
We have about 2 minutes left, so I do have a bonus question because I'm not seeing any new ones popping up in the chat. In a nutshell, if any of you could tell us, who are the winners of the current system? Because it seems like some of the countries are complaining about it. Even the companies are somewhat complaining about it to a certain extent. So who's truly benefiting from the system and maybe blocking changes? Can be you, Eurydice, if I know you're very knowledgeable about that as well, but
what was the question? Who's blocking change?
Who's benefiting from this secrecy system that we have at the moment?
Definitely the ones who are most strict about enforcing it, which is industry. It's this. I don't think there's any doubt about this. And the OECD study that showed us that countries would like to get rid of secrecy, they just don't know how exactly to do it, what the mechanism should be, is really something that reinforces our findings, what all our sources told us, that this is really an industry-driven system. Be a way to overcome this without having industry suffer so much that they don't produce any more drugs. So there must be solutions found that benefit everyone. Right now, what's clear is that the current system has many losers, and it's very important to talk about it and not stick to the advertisement and very rosy picture that we are sometimes sold.
And obviously, I mean, there's something we've heard as well during the investigation is that some big countries do believe that they're somewhat winners as well because they manage to get drugs fast and big rebates because they have big markets in particular. Okay, one final question. I mean, someone was asking about Trump earlier as well, and I see there's a new question about the US here. Anyone wants to react to what the recent election and US deregulation might do to us? I remember during the COVID crisis that that was one of the issues that we negotiated in Europe, vaccines after the US, so they sort of set the bar. Do you have any comment on this topic? Otherwise, we'll close.
I want to say, please, Bill.
Go ahead. Well, the US already has much higher prices than Europe, and it took Biden a long time to actually being allowed to negotiate. So now he's negotiated 10 prices, and the industry is claiming that is also making their life difficult. Don't know what Trump is going to do. If he going to give the industry more leeway, then it can only mean more higher prices and more higher profits. So there is a need to actually make sure that we can keep these companies to their taps so that they actually do the thing to do for their human right to access to essential medicines and so on.
What I want to say on this, yes, is that there's this disruptive company in the US, the company of Mark Cuban, who is enforcing a cost plus. He is doing a cost plus system, so his prices from his company are much lower than the usual, and Trump totally hates him. So I don't know if this tells us, because sometimes politics is personal also, if this tells us how Trump also feels about this general push to reduce drug prices and harm industry profits. I wouldn't be optimistic at all about the new administration on this. There's been a lot of interesting actually questions in the chat. I don't know, Max, if you want to continue or if you want to close it here.
Well, I haven't been able to read all of them.
Okay, so let me just very briefly at least say something on Els Torrel's comment. Els is a very knowledgeable researcher on pricing issues, and she's pointing out that the change that we were talking about, so joint negotiation is a technical change, and joint procurement is a technical change, and what we would need is changes in power and how really power is being enforced from the countries. And while I understand that this is indeed what must happen, so inside every country, the power dynamics must change, and the policies must change, and governments must demand transparency and all this, I would not call a joint procurement initiative a technical thing. Many political careers have actually suffered by trying this. So I do not. I think it is also very much connected to power dynamics inside countries. And also, there's another question in the chat. There's Professor Mark Rodwin, who actually invites us to show him whatever contracts, confidential contracts, we can get our hands on, and that he can explain, can help us read through them. We can't get in those contracts. If anyone does, this will be major news and very dangerous also.
Yes, I mean that would be probably a breach of the contract itself. But I mean, if you do get your hands on them, Mark, I think you do have a story, probably.
Let us know, please. Let us know.
I think that is taking us to the end of this webinar. I want to thank everyone for joining us today. Special thanks to the people on our panel, of course, for their time and expertise. Just a reminder that this was recorded. So if you do want to get a clip of it, just subscribe to our newsletter or follow us on social media, and we'll be sharing it there. And obviously you can also follow all of our investigations, articles, news on our website, which Andrea has been posting, I think, a few times in the chat as well. So I think that's it from us, and thank you very much for your time.